Hello and welcome to Health Reform Watch, a collaboration between Reuters and the Forum at the Harvard School of Public Health. I'm your host, David Morgan, healthcare policy correspondent for Reuters in Washington. And with me today is Professor Robert Blendon of the Harvard School of Public Health. Professor Blendon is a leading expert on healthcare policy, politics, and public opinion. And he's here to talk to us today about the 2014 midterm elections and the upcoming 2015 insurance enrollment period for the Affordable Care Act. Hello, Professor. Welcome to Health Reform Watch.
David, glad to join you again.
Always nice to have you. As you know, Republicans once had great expectations for Obamacare as a campaign issue. They thought that it would persuade independent voters to vote Republican. They thought it would bring out the Republican faithful at the polls. And contrary to those expectations, the issue appears to have fizzled by and large. Yet, the Obama administration needs to launch a public outreach campaign to convince people to enroll in private insurance through the Obamacare marketplaces, open enrollment beginning November 15th. It just so happens that that public outreach campaign will hit critical mass next month, just as the election campaign is reaching fever pitch. And so my first question to you is whether this sets up another message war between Republicans and the Obama administration.
I believe that it will turn out to be one of the three or four, not the issue, but was just announced today in a number of press sources that spending for Senate races, for advertising, healthcare remains the #1 issue candidates are spending money on. So it's hard for me to see people spending millions of dollars on ads and talk about fizzling in the same conversation. And I think what's happening is that people don't think they can win over undecided issues, voters, on the health care issue, but they believe it could affect motivating poor Republicans or Democrats to come out and vote because they're either going to change something they don't like or protect something that's important. So I think we're going to find that the ads and the messages through the election are likely to still have a very strong health care flavor to it, even though other issues are there. The real issue for enrollment has to do with when the election is over in the early part of the enrollment period. And that is, should Republicans win majorities in both House and Senate, a significant number of the leadership said that they would make some effort to actually vote repeal of the bill in both houses, even though it's unlikely to ultimately happen with the president vetoing it.
Right.
For average people who didn't enroll the first time, you could be thinking about whether or not I'm going to join, sign up somewhere, trying to struggle, what is it I'm actually going to pay?
Yeah.
Turn on the news and hear people talking about votes for repeal or what, or changing. And so the messaging, if there is a change in who is the majority in the Congress, could be very confused to people.
Are you saying that Obamacare, even though there have been all of these headlines about how it has declined as an issue, that it could still be a deciding factor in the November elections?
This is always a problem when you're talking about issues. There are really 14 contested Senate races, and that includes those with open seats. At the moment, the poll differences are 3 to 4 percentage points for the candidates running for many of these seats. There are 3 or 4 issues. The economy is not the majority issue. Now there's terrorism, there's immigration, there's concern with how the administration is running the government, and health care. Just in the recent CBS New York Times poll, 1 in 7 prospective voters said it was their top issue. So when you have a very close election, almost any of the top issues could be deciding it. And in this case, and it's very hard for people who don't follow politics to recognize, more than half of Americans, for various reasons, will not vote in November. And so the secret to winning this election is to get people who who are motivated and leaning towards your party to stop and vote or vote early. And for a share of voters, health care will be motivating for them to vote. So I absolutely think when the election's over, it will be one of the 3 or 4 issues that will count, but you have to realize all 3 or 4 will determine who wins. And the people analyzing the advertising buys, which actually reflect what political consultants advise candidates over, are saying spend more money on health care. It'll get some people out on our side, depending on which way the ads are, and they're not quitting. So I think it's not the issue in the election is quite mistaken.
Right.
It's not the issue for the undecided voter.
If the Republicans win the Senate, do they need to be able to say in some fashion that it was Obamacare, the issue that helped them win, in order to launch into some sort of a repeal or dismantle program?
Political scientists often point this out after presidential elections. It's not clear that an issue settled the presidential race, and presidents always claim mandates. For that, whoever wins is going to claim that they had a mandate from voters either to go ahead with the ACA as it is or to really redo it or scale it back. So it's just standard. All it takes is for an issue to be one of the top 3 or 4 for the majority winner to claim a mandate. That doesn't mean the president's going to react that way, or other members of the Congress.
Right.
But they absolutely will, and they'll say that it was important to their election. But they'd say the same thing about immigration or national security concerns. They'll say their view, whoever wins, really was a mandate, because they are important issues, but they're surely not the only issue that decides the race.
So if the Senate goes Republican and the Republicans start talking about repealing the Affordable Care Act or dismantling it in some way, what is the implication for the administration's open enrollment period?
What will just be confusing to people who didn't sign up the first year. If you signed up already, they're going to re-enroll you even in the plan you're in, unless you choose another one.
Right, and the Congressional Budget Office is saying that it expects another 7 million first-timers to sign up. So
it's among the first, David, exactly where you are. It's the first-timers who could get very confused by this, because people do not understand when they hear Congress talking about repeal or the president this, who's actually making the decision. And so in reality, it's not at all clear that they could repeal this bill. But at the moment that you're signing up, you'll turn on TV or read the newspapers, and political leaders will be talking about scaling it back, reducing money. And so for people who are reluctant to sign up the first year, they're going to be confused. Is it possible that I could buy a policy and end up having to pay more, or the policy isn't going to be there, or the program is going to be there? So there's going to be this confusing messaging where one group of leaders is talking about scaling back, changing, repealing, whether or not it'll happen or not, and the others are saying this is a solid program, look at the benefits you get, sign up, move ahead, don't worry.
And is that sort of confusion something that could affect the success of enrollment and the success of the marketplace in its second year?
It clearly could affect the number of people who sign up the second year. The critical issue about sign-ups is that you're not left with a situation where only people who are very ill sign up and everybody else decides they're going to wait a year or two and see what happens. But if that doesn't happen, they just will have less people. But the critical issue would be what happens ultimately between the president and the Congress.
Understood.
If there is no party change, then I think we're down to all the issues, which are, does it make sense for people who didn't sign up the first year, who had a chance to sign up this year?
Well, thank you very much, Professor, as always, for an enlightening stroll down the political avenues of the healthcare world. And thanks also to our viewers for tuning into this edition of Health Reform Watch. I'm David Morgan. See you next time.